Hi, I'm Andrea, and I'm going to be talking about my theory synthesis final project. The topic that I chose for my project was why do patients or family members of patients choose life-saving measures during the end-of-life care? And so the concept map that I have created has extreme measures in the middle, and surrounding that encompasses why patients or family members may choose extreme measures. So self-efficacy includes the hope and determination to survive. Lack of understanding incorporates a patient or family member not understanding fully what a treatment may entail, and so they would choose it. Cultural beliefs such as religion, culture that does not allow for extreme measures to be taken or death to occur naturally in the event that they didn't do everything they possibly could. And then ethical considerations such as pain, comfort, quality of life, and then not having a will, a POA, or somebody to acknowledge what your wishes are at the end of life. And I think that this topic is important because we should be thinking about all of the aspects of our patient's life, not just what seems most logical to us. There's a lot of financial, ethical, cultural, and other factors that play into the type of care a patient chooses. And it's important to think about that when considering that these questions, families might ask the nurse what to all think about, and the provider might ask the nurse what is the family's or patient's reasoning for choosing this to make sure that the extreme measure or chosen intervention is best for them, and just having those answers on hand can be helpful. And I really learned a lot from the research. I learned about understanding all of the factors that patients think about when determining their treatment for end-of-life care. And according to Brizzi et al. 2019, not only are code status and life-sustaining measures important to talk about when determining what the patient wants to endure, but also what procedures and treatments are worth undergoing when balancing comfort and quality of life. The Cleveland Clinic 2022 also has helpful information when thinking about having conversations with patients about their wishes from the beginning when they're admitted. So in the event that they are no longer able to convey them, the best course of action can be taken. And also remembering that patients' cultural or religious standpoints, according to Yi 2022, this article also talks a lot about what medical interventions could be acceptable or not, depending on the patient's beliefs, such as blood products, organic materials, and things like that. And for my theory, I chose Barbara Dossey's theory of integral nursing because I think it encompasses not only all of the aspects of a person's life experience, but also can contribute to the decisions and what type of care they'll choose. And it also allows for different viewpoints to be understood. And this is all according to Dossey 2020. And the theory also allows to take into consideration ethical, social, financial factors that are important when the patient chooses end-of-life care. And so this is the map that I created for the theory of integral nursing. Health is at the center, the nurse taking care of the patient, as well as the person themselves, their personal experiences, the health and condition that they're in, if their situation allows for treatment or if the prognosis is not great, and then also the environment and society, including their family members and things like that. And then aesthetic knowing, not knowing, ethical knowing, and socio-political knowing are all on the outside. Not knowing goes again with the ability of the person to know and understand what all plays into choosing extreme measures. Ethical knowing is their pain quality of life, comfort measures, having a POA, things like that. Socio-political knowing includes extreme measures may be very costly to the patient, and kind of taking that into consideration when choosing what extreme measure or end-of-life care they decide. And then aesthetic knowing is discussing with the patient what they think is a good death or how they would like to continue on with their treatment. And I really think that Barbara Dossey's theory of integral nursing hits all of those aspects really well. And also around that could be different viewpoints of the self, others, and kind of taking that into consideration as well. And my greatest aha moment would definitely be, what is a good death? I know that that can look different to everybody, so kind of understanding what each individual thinks is best. And then my main takeaway is just remember to think about all of the different aspects, not just what you think is the most logical decision for the patient. Thank you.